Good afternoon, everyone. I'm Bert Eichold, Health Officer in Mobile County, and we're very excited that vaccine for the Health Department has arrived. We are the frontline troops with COVID-19, along with our partners at the hospitals, seeing patients, also doing screenings, and now we're going to start doing vaccinations. It's my time now to go from being a healthcare provider, where I see patients in my clinic, to now becoming a healthcare consumer and receiving the first vaccine for the Mobile County Health Department. This is an exciting time. It's wonderful, and please, everyone, plan to take the vaccine when it becomes available to you. It's extremely important for us to contain and control the spread of COVID-19.
Thank you, Dr. Eichold. So indeed, we were all pretty surprised this morning when we got a text message with a photo of the vaccine box. It says, "Vaccine just arrived at 9:06 a.m. at the Mobile County Health Department." There was a news release today by the Alabama Department of Public Health confirming that Moderna COVID-19 vaccine was arriving in some Alabama healthcare facilities today and over the next couple of days. And the first allocations, started arriving, as we said, pretty early this morning at hospitals, at pharmacies, at a lot of health departments across the state. So we're really excited about that. According to the state health department, the guidance is that 50% should be for hospital healthcare workers, 15% for EMS providers, 15% for physician offices, and 20% for other staff or healthcare workers who aren't associated with points of distribution. Then residents of long-term care facilities will be vaccinated through the federal pharmacy program in cooperation with some big pharmacies. Doing okay there, Dr. Eichold? All right. So in accordance with the vaccine instructions, Dr. Eichold will be monitored for the next 15 minutes to make sure that he has no adverse events associated with the vaccine distribution. If he were to have been the person who maybe carries an EpiPen or has had some other severe allergic reactions or anaphylaxis, we would be monitoring him for an additional 30 minutes just to make sure that he's all okay. This is the first dose that Dr. Eichold will receive. He will need a second dose in 28 days. There's a couple of days of leeway there, but for the most part, 4 weeks from now, he'll get a second dose of Moderna vaccine, and then about 1 week following that second dose, he will have, prime peak immunity to Moderna, to COVID-19 due to this Moderna vaccine. So again, just to remind everyone that vaccination is important. It's a life-saving opportunity for to prevent COVID-19. Super important. The first doses are going to be made available to healthcare workers, and as we slowly begin to see more and more vaccine roll out in January, February, March, then you will see other priority groups that will be listed for vaccination for Moderna and Pfizer. So we're just not really sure what the new year is going to bring with regard to our allocation, but we're excited at the health department that we received some doses today and we'll be able to vaccinate our frontline healthcare workers. We're also partnering with another federally qualified community center, health center, to help them get vaccinated, and some other locations that were not directly on the list to receive vaccine, but that serve communities and serve populations that we hold dear to the health department, so that we can try to protect those. So before I talk a little bit about the numbers, talking about good things, over the weekend we had our second Know Before You Go COVID testing event, and I'm going to ask Dr. Kelly Warren, Executive Director of Family Health, to come and tell us about that event. Kelly?
Thank you, Rendi. Hi, everyone. Not a doctor still.
Oh, sorry.
but so appreciative for all the doctors in our community. We had a wonderful event this Saturday. If you came out and got tested with us, we hope you had a good experience. We appreciate you coming out and getting tested. We do believe that information is the best defense against COVID-19, so knowing the right thing to do and then doing it. We had 3 sites that offered rapid COVID testing this weekend at Sims, 8 Mile, and then our downtown Keeler location. Hats off to the team for running really smooth, really fantastic events. From 10 to 2, they managed to test 931 people, and we had 70 positives during that time. So we're just excited about the prevention that this is fueling in our community, so that those 70 individuals who found out they were positive can now make good decisions to protect themselves as well as other, family members and friends, people that they may have had some holiday plans with, hoping that they go home to isolate. We are just happy to be here in the community, and again, hats off and huge thanks to our MCHD Family Health staff for serving with a smile for a long day Saturday, and thank you to the public for coming out and taking advantage of this great testing opportunity. Thank you. I'll turn it back over to Dr. Murphree.
All right, so it's noteworthy that 70 out of 931 tests performed on Saturday were positive. That's twice as many COVID positive test results as we saw at our first Know Before You Go testing event. So we know that there is widespread, accelerated, ongoing community transmission of COVID-19 in Mobile County. I won't go through all the numbers today, but for Mobile today, we're reporting 23,745 cases of COVID-19. 186 cases were added yesterday, Sunday, 226 added Saturday, 134 Friday, 237 last Wednesday. So we are seeing those very, very high numbers of COVID-19 cases reported every day. The likes that we have not seen in many, many, many months. In total, we've had 420 who've died with COVID. We had a batch of death certificates that were uploaded over the weekend, which if you have been doing the math from Friday till today, we had, over almost 25 deaths added just over the weekend. But again, the dates of those deaths have been occurring, back for many months. So it's just that they were reported to us on Friday. Total number of hospitalizations is at 3,003. 18 COVID hospitalizations were added yesterday. And looking at the number of people in the hospital with COVID-19, yesterday stood at 149. So we have been averaging in the the high 140s over the last week or 10 days, higher than we would like to see, but it's good that it's not any worse. Our hospitals seem to be coping, well with what they're seeing. But again, we just are really pleading with you to do the things that you need to do, or the things that you can do to slow transmission, because we know about 50% of the cases that occur result because, from people that don't know they're infected. So, people who have who are infectious with COVID and are spreading it without knowing it. So that is an important message, just to remember the largest age group. So most of the cases are in the 25 to 49 age group. So those are the folks that will have mild symptoms or no symptoms with their COVID infection, and can potentially spread it to others who then might suffer complications of COVID-19 that might require hospitalizations. So again, we just want to slow the spread of COVID to try to preserve our healthcare infrastructure, try not to overwhelm our hospitals, so that when those people need hospitalized care, it is available to them. Let me see. I will shorten my report today since we've had kind of a big day here. Just want to mention, if you live in zip code 36572 or 36571, this is still where I think this is Satsuma and Saraland. We are still seeing the highest rates of COVID transmission in those zip codes. And then this week, it really popped up in South Mobile, where in the last 14 days, we saw high levels of COVID-19 in the Dauphin Island zip code, and also in South Mobile zip code 36544 and 36509. So if you live in those zip codes, you live in areas that have have the highest rates of COVID transmission in our county right now. So be careful. So as Kelly mentioned, knowledge is power. Testing, knowing when you're COVID positive is really important. Getting vaccinated when you have the opportunity is important. But continuing to wear your face covering, distance, wash your hands, disinfect surfaces, stay at home if you're sick. Try to avoid gatherings. We had a lot of talk in my small family gathering over the weekend about, a gathering is a very simple term, but seems to be very misinterpreted by a lot of people. So if you are around people that don't live with you, that's a gathering. So it can be a dinner or a gift exchange or a light viewing party, all of those things. It's a fact, they increase COVID transmission. So please do what you can to protect yourself if you do have small gatherings. All right, so a couple of questions and then we'll call it a day. Still doing okay back there, Dr. Eichold?
Yep.
Thumbs up.
Great.
All right. So someone asking me to talk about the push for getting tested before holidays, and really this has to do with sort of the whole know before you go idea is before you travel, please, excuse me, I have something on my lip. Before you travel, it's recommended that you get tested 1 to 3 days before you travel. This applies if you're going across the county, if you are going out of state, or if you are going out of the country. If you are traveling on any type of conveyance, try to get tested 1 to 3 days before travel so that you can know your COVID status and stay at home if you test positive. This is really important for people to do. And then CDC recommends also if you have, if it's more than just an evening or afternoon trip, if you're gone for a couple of days, when you get back, also think about getting tested 5 to 7 days after you return. There's plenty of testing available. If you did not make it to our event on Saturday, you can call our appointment line to get tested at any of our 8 mobile clinics by calling 690-8889 to schedule an appointment for a no-cost COVID test. All right, some other questions about the vaccine. So people asking, when will non-hospital-based healthcare providers have access to COVID vaccinations? So this is a really good question. We have been working closely with our hospitals and also with the Mobile County Medical Society to try to make sure that providers, healthcare providers, physicians, know where to go to get a COVID vaccine. So I believe some information was going to be pushed out today by the Medical Society, the Mobile County Medical Society, and if it was, we'll try to pass that along. There is not right now just a walk-up opportunity to get vaccinated. Most of them have to be done by appointments or through referral networks. But as soon as we are able to provide sort of just open appointment-driven COVID testing, we will. It could be some time. But we also have other frontline providers, dentists, optometrists, funeral services directors, those sorts of things, who are all sort of chomping at the bit to try to find out when they might have vaccine available to them. So someone asked about a requirement for getting a second dose. Once you get the first one for the Pfizer vaccine, it's 21 days before the second dose, and for the Moderna vaccine, it is 28. Also, one of our Facebook viewers asking, when will elderly persons with health issues who live at home, how will they get the vaccine and when will that occur? And this viewer mentioned that they spoke with their doctor's office who didn't have much information. Well, no one has very much information right now on when there will be more vaccine available, how the allotments will be made, when the prioritization will extend to people who meet some of the higher risk groups by being older or having underlying medical conditions. And then I had a question, we get this question a lot, people saying, wait a minute, if you're quarantined or you're isolated, doesn't that mean you're supposed to be home? And the answer is yes, you should do that at home. And then folks say, but my office is telling me to come into work anyway, or my friend's neighbor is told that they have to go to work, they've been told they have to go to work anyway, even though they're supposed to be on quarantine or isolation. So the rules are, if you test positive for COVID, you must stay home for 10 days. No getting out of it. If you test positive, stay at home for 10 days. If you have been exposed to someone with COVID, they live in your household or they were at your family gathering, if you're exposed to COVID, the preference is to stay home for 14 days because you could develop symptoms between 2 and 14 days, or you could not develop symptoms and you could be asymptomatically spreading COVID. If you cannot stay at home for the entire 14 days, then there is an option to stay at home for just 10 days as long as you are asymptomatic that entire time and you actually document each day that you have no COVID symptoms. So, isolation, stay at home, quarantine, stay at home. And like I said, do all those other things that we need you to help us with to slow the transmission of COVID-19 in the community. Wear your mask, get vaccinated when you get an opportunity to, wash your hands, disinfect surfaces, stay at home if you're sick, avoid gatherings. So I will stop there for today, and we will not talk to you on Friday. I don't know that we'll do a Facebook update on Wednesday, but if there's something that comes up between now and then, we can always pop it in. So if you have questions, hit us up on Facebook. And with that, I will close today. And remember, stay safe and be well, everyone. Thank you.